The yeah, well, you saw me out at St. Vincent's, didn't you?
I think so.
Yeah, and
I think
we
so.
kind of went through that phase. I was leaving it back there, and the PSA would look like it's pretty low, but the creatinine was jumped up there, and then we had issues with it, kind of going back and forth.
Mm-hmm.
And then, so I was trying to figure out. After that, I went to urologist, and then we couldn't do the ultrasound or the MRI because I had a pacemaker.
Yeah.
So we had to call that off, and then they did I think he did an ultrasound. And as far as I know, there wasn't anything found with the ultrasound. I mean, it's pretty clear on that. But then again, I was because I still have hemoglobin and some of the fluid levels that I can't do a procedure on my right leg. If that has to do with the arterial artery, I guess, that being plugged. They did one on the left leg, but they could because my hemoglobin wasn't high enough or wasn't right, and then I went to the Carti, and the guy there was pretty good, and he looked at things and said I need to probably start taking shots to get the iron, probably iron level or whatever you need to do.
Erythropoietin level, yes.
And then I went back, and then they said since I'm at rehab that the PCP there probably couldn't do much, or they couldn't do much until I checked out there and maybe went back separately. I guess that's a Medicare thing or something, or cost thing. So I'm kind of going in loops and going out and seeing different people at different times, and I'm just trying to get a clarity on do I have, other than this procedure that I'm trying to do, is there any other issue that you're seeing or anybody else seeing about my kidneys or anything that
So what type of procedure are they going for?
Well, the peripheral arterial disease stuff, they had some blockage there, and they may have created some of the stuff that created the wound. We saw that in the left leg when they ran it down ran that hose down through there. They cleared out some flack, and they didn't have to put a stent in there, but it kind of cleaned it up. And then later on, I thought they had already looked at the right. They found a kind of a wound that was developing, and it kind of even developed as much, about similar to the left foot heel. So then they wanted to do another procedure there, and they couldn't do it because of the fluids. And so I was I think I'll go back to see them for 1st of July. And I'm afraid I either cancel it because my fluids are not high enough, and I didn't take that shot, which, and so I'm kind of wondering if there's any workaround or if there's anything else I can do. If not, then I guess I have to postpone that until I can take the shot or take something, because there's a cost item there that doesn't not covered where I am right now. I guess nobody's telling me exactly what it is, but you can kind of figure it out.
Yes, sir. So actually, when I saw you in St. Vincent's, because of that obstruction, a number of things were going on, so kidney got damaged, and at that time it was an acute event, so we tried to fix that out, and it helped you out some. Last time when you were seen here, your kidney numbers improved a little bit.
Yeah.
Your creatinine came down, but it is still quite high. For any type of intervention can be done, but if that intervention needs or any procedure needs a contrast, you are not a candidate for it. But if there is no contrast, then we can do it. Rest, your low hemoglobin level, it may be a combination of kidney disease or something else going on. So Carti is taking care of that part. I think you still need that shots for your hemoglobin, because last time when they were checked in the early this month, your hemoglobin is still 8.6. No one will take any type of procedure risk on this hemoglobin.
How does it have to be?
It has to be around about 9 and 10.
Oh.
8 is low because any procedure can cause bleeding. If it goes down to 6, things will not be good.
So 8.6 is too low then?
8.6 is low.
Okay.
It has to come up at least at 9 or 10. Then it depends upon the surgeon or the procedure, whosoever is doing procedure, at what level he is comfortable at.
Well, they said on the July 1 meeting they were going to reevaluate.
That's what I'm saying. So it depends on the whosoever is doing the procedure.
Mm-hmm.
If he is okay with hemoglobin of 8.6, he will do it.
Yeah.
But if I am the one who is doing procedure, I will wait till it is more than 9.
Okay, that's
Okay.
what I was kind of getting at. Is I'm kind of in between,
Yes, sir.
and I'm getting, I'm glad for some clarity on that because that's where I am. Is that
Yeah.
I'm kind of going back and forth. I think what I saw on the PSA and some other things, and I kind of question the guy at Carti because, when I think Carti, I think cancer, and I didn't see anything with a colonoscopy or PSA or anything of that.
No, so basically they also treat anemia as well.
What's that?
Low hemoglobin, they also treat that as well. CAR-T is for oncology, for malignancy or cancer, but they also treat these things as well.
Okay,
Okay, because they have the infusion centers for it.
Okay, well, that's what I asked the question several different ways just to get some clarity on my own, and I didn't sense that. And then I think when we were out at the other place there's the question of whether I'd have to have any treatment on my kidney, and you didn't think so at that time, but things change. I'm not sure.
Things change now. Now the thing is that are you having any blood pressure problems, like high blood pressure and something like that?
It floats a little bit, but I don't think it's real high. I mean, nobody.
Were you on any medication like as losartan or something like that?
Yeah, I've got some. I've got a whole bunch of different, about 10 or 12 medications, but I don't know.
Yeah,
the list might indicate.
It is not showing me anything.
Do you see anything on the list that would be?
I am seeing the things. One is your insulin, then your iron supplements, calcium supplements, vitamin D, amino acids. Like everything is basically the supplements and amino acids.
Well, they
and
do.
Insulin.
Yeah, they did blood sugar 2 or 3 times a day.
And it is fine now.
Yeah, I think
Good.
they keep coming away and saying that, and
So
I just very rarely do they do an insulin shot. I mean, maybe 3 or 4 times over
So
there.
here's the catch, sir. Because of your kidney issues, I want to start you on a medication known as Farxiga or Jardiance. Okay? But for that medication to be started, I don't want any type of infection. If there is an infection going on, if there is anything which is infected, I cannot give you that medication. That medication, the beauty of that is that it will help with your kidney functions, and it can also control your blood pressure, and it can also help with the blood sugars as well.
Yeah.
You are on insulin, I'm okay with that. I want to start you on Farxiga, but it depends on the kidney numbers. Last time when you were seen, your creatinine improved, but you remain in stage 3B or stage 4. Stage 4 kidney disease is a severe kidney disease.
Okay.
So right now I am not in a hurry to start that medication. I want to look at your urine for any possible infection. I want to see the other stuff, how the things are looking like. And if everything is fine, then I want to start you on a medication known as Farxiga in 5 milligrams. Farxiga will help with the peripheral arterial disease as well.
Okay.
So it is a good medication, provided your kidney allow me to do it. Okay.
Yeah.